Obviously, we've been planning for some time. Our agencies have been anticipating the worst. So they've been working over the weekend. They were working some last week, different ones at different times, trying to come up with information and or a plan. Basically, it'll affect different agencies differently. There's some that are exempt. For example, emergency management is, with their federal employees, are relatively exempt from the shutdown, federal shutdown. But we've got other agencies where it can be catastrophic, like the health department has a huge number of employees that are paid all or in part by federal funds. Human Services is significantly impacted by the shutdown. So, I mean, it will vary. It will vary depending upon what the agency is. As I've said, the state is not in a position to, nor will we, bail out the federal government. I mean, we just don't have the resources to be able to do it, nor is it our intention to do so. Now, we're trying to take some steps. Let me give you an example. Why not? I might as well say it. What are they going to do to me? When we had that ice storm, y'all remember, that was so bad, there was a huge industrial generator. In fact, I think there were two of them on trucks. We were just sitting, and I guess they've been sitting there for a long time for other purposes or contingencies or whatever, up around Fayetteville. And, we had hospitals and all sorts of folks didn't have any power. I mean, we had folks that were and likely to be without power for a long time. That ice storm hit so many counties and shut down so many stuff. And I got the word that it was going to take a day or two to get federal permission to, I said, cut the chains, get them off the truck and hook them up, and I'll apologize to the federal government later. Well, we got a little bit of a wrinkle with regard to a lot of our human service issues that's comparable. We don't know what they're going to do in an audit 6 months from now or a year from now, but we know this. Doing what we need to do to maximize protection of our kids, for example, in Children and Family Services, will require some unorthodox and unusual things. As an example, with a lot of these employees, it's a match, some state money, some federal money. So let's say we got an 80-20 match where the state's paying 80% of these salaries and the feds are paying 20%. John, how am I doing?
Doing well.
And I don't want to get the percentages messed up. Well, I mean, you can't take an employee and say, you come to work, we're going to pay you 80% of what you're getting paid. I mean, that's just not feasible. So in effect, what you have to do is you have to cut 20% of your workforce. If you got enough money to cover 80% of the total obligation, then let's keep 80% of the people working. Now, the tough job is going to be deciding who the 20% that get furloughed are, but we didn't cause that. The feds are doing this, not us. But we'll run afoul, I'm sure, of cost allocations from the feds at some point, a year from now or 2 years from now or whenever they audit, that we used 100% state money and 0% federal money for these employees that we kept on. But the alternative is that to let everybody go home. And we don't want to let everybody go home if we can salvage some of them to take care, particularly of kids. And these are kids that we've got. Remember when we put all that extra money in extra positions because we were doing such a miserable job because we didn't have enough people in child abuse investigations, abuse and neglect investigations? And we added all those extra people to answer and respond, to do more timely, be able to more timely respond. And the legislature responded at the request, and we added those people. Well, that's some of the very people that would, if we didn't try to go this route, you'd have 100% of them sitting at home who'd be doing these checkups on these kids that are being abused or being neglected. Some of them we're going to suffer anyway. There are people who are going to get hurt by this stuff, by what's going on in Washington. Real people, and usually, I mean, they're children. There are people in nursing homes that aren't going to be protected because some of the protection that's there is paid for with people that are either all or partially paid for with federal money. Our tax dollars, your tax dollars and my tax dollars that go to Washington and then get distributed back. So this is real. And there are real people that are going to suffer as a result of this. And what we have to do is the best we can to minimize that suffering, but by no means am I naive enough to think that there's not going to be some adverse ramifications from this that obviously I can't control. I'm not in charge of federal money. I'm not in charge of what they're doing up there. If I was in charge, we'd solve this problem. I don't think there's anybody up there that questions where I stand on a government shutdown. I mean, it's just, I think it's inexcusable, absolutely inexcusable. I mean, you know, that's not what the founding fathers thought they were doing when they created this democracy. And that's not what the American people elected these folks for.